Choll from the Spine Institute of San Diego, and I want to talk to you about the informed consent process. This is something that we do before surgery, and I want to spend some time kind of explaining what's going to happen when you have decided to do surgery and you go to the doctor's office and you go through all the paperwork, I guess, to make the surgery happen. And I want to talk to you about what will happen if you decide to have surgery with me. We'll do a lot of things related to making sure that the insurance is cleared, the proper data set, and work with all your medical doctors to make sure that your other medical problems are optimized. And once all that is done, about a week or two before your actual surgery date, you'll come into the office and you'll have what we call a pre-op clinic visit. And you may have more than one, but the one pre-op clinic visit that I'm talking about today has to do with coming in to do what we call the informed consent. And we can go on all day about what the importance of the informed consent is, but one of the things that you'll notice when you come to the office is that you'll be given this form. Not too different than when you buy a house, they whip out that big thick pile of paperwork and just signing things. It's not too different from that. And this informed consent does a few things. One, it's a detailed explanation of all the potential issues related to surgery. A lot of it has to do with the risks and the goals and things like that. And it is a relatively long form with at least 20-something items that you'll read through in detail, and hopefully you won't fall asleep in the middle of it because it's not very interesting. And you'll initial every one of these spaces right here. This second page is the one that freaked people out the most. It's number 8, and the title is The Risks of Surgery. So imagine what it would look like if you were signing a waiver to drive on the freeway and you got to the section, the risks of driving on the freeway are, and it lists all the possibilities. You can imagine what that's like. That's kind of what's on here. So fortunately, most of these things are rare, but they're not zero, and it's important that you realize surgery is surgery, and there are risks associated with it. On the second page, there's a couple of things that people ask me about a lot. The first one is number 7. Number 7, this dense paragraph, has to do with video recording and observers in the operating room. I suspect that you know I tend to videotape a lot of my surgeries for a variety of reasons. So I would like to videotape your surgery, and you can have a copy of the video so you can feel like you know what's happened. It's private until you tell us that it can be made public. And if you want us to just get rid of it and never have videotaped it, that's fine too. I'll also have observers in the operating room. I have a lot of people wanting to see how I do the surgery because I do a lot of minimally invasive surgery, and that's a relatively new way to do spine surgery. That's probably why you came to see me in the first place. But a lot of people are interested in doing it that way, and so I have a lot of surgeons, I have a lot of other medical personnel wanting to see what it's like to do minimally invasive surgery. And item number 7 is just simply saying that you know that that's going to happen and that you give me permission to have observers in the operating room and to videotape. And once again, I will try my hardest to make sure that your modesty is maintained and there's no unnecessary observing except during the critical parts of the surgery. That'll be number 1. And number 2, any video that we shoot, we will run by you before we do anything with it. Obviously, because that's what I would want if I was the patient. So the rule of what would I do if I were you still applies, and that's what number 7 is. The other section I want to point out is number 11, only because a lot of people ask me about number 11. Number 11 is about neuromonitoring. And basically I use neuromonitoring as well as intraoperative imaging and navigation and any other reasonable technology that allows me to make the surgery safer. So neuromonitoring is one of the things where we put little needles with wires where we can monitor nerve activity, and one of my colleagues sits in the operating room hooked up to all these wires with a computer program, and they're telling me, oh, you're too close to the nerve, or the nerve is irritated. That way, as I'm doing surgery through a small little incision, I have as much additional accessory information to allow me to do the surgery safely and to make it perfect. And so, registry information and consent form. And basically, it looks like it's a research study, but it's not. You just have to make it, you just have to go through the same governing body that governs clinical research on human subjects. So it kind of looks like that, but all this form is doing is telling you that all the questionnaires, all the scores that you fill out on the clinic questionnaires, the thing that I call Form 1, I can use that form and I redact all your personal information, put it into a database so that in like 5-10 years, if somebody says, what can I expect from my surgery? We will have a database of information so that I can more reasonably predict the likelihood that you'll have this result, that result, this complication, et cetera, et cetera. It'll be much more accurate. And just as importantly, like any professional athlete, if I want to get better every year, I have to keep track of my results. So I have to prove to myself that this year overall, I'm doing a better job for my patients than last year. And guess what? Next year, it would be my goal to do even better, and after that, even better. And the only way you can do that is to generate outcomes data that you fill out, and I need that data in a format where I can crunch the numbers. And that's what this is for. And I think everyone should be doing this, and I suspect at some point in time, a consent for registry data will be entirely unnecessary, but until that time, I need you to fill this out if we want to do the perfect job for you. In addition to my pre-op appointment, that's the one where we talk about the surgery itself, you'll also have a pre-op appointment with the facility or hospital where we're going to do the surgery. At some hospitals, they'll want you to come in for a separate appointment. In other hospitals, you can do it by phone, so expect that, and don't forget about making sure that that happens either before or shortly after my pre-op clinic appointment. And at that appointment, among other things, they will go over your medications and go through the process called medication reconciliation, which is a fancy term for, we just want to know what medicines you're on so that when you come to the hospital, we can continue those medicines, no duh, and give you the right dose. So when you go to the hospital pre-admission appointment or do their phone call, make sure that you have all the medicines that you take, including the amount, like the milligram, and the frequency, and any other allergies so that they can document that. And they'll also go over some more logistical details about the morning of surgery, and they may give you more information about where to go, etc., and ask you some more medical questions. But the key thing, at least from my perspective, is that they will go over the medications so that we know exactly what to put you back on. Number 9 is another one that a lot of people ask me about. It's called pain after surgery. I think most people are going to expect that after a surgery, they're going to have surgical pain. And one of the reasons why you're doing surgery with me is probably because I'm doing it minimally invasively, and the whole goal of minimally invasive surgery, among other things, is to decrease the post-op pain, because the bigger and nastier the incision, the more incisional pain that you're going to have. So doing the surgery minimally invasively will decrease that, but it's not going to make it zero. But I think the more important aspect of this question has to do with what can I expect during the post-op recovery period? How long is it going to take for me to recover? And what's it going to be like at home during the first week, second week, third week, etc.? Because I would have that question and I would be wondering. Unfortunately, I don't have a good answer for you, because people's post-operative recovery is so all over the place. It is so variable, it's shocking. And it is due to probably a few key variables. The first is something that you can't do much about, and that has to do with your body's inflammatory reaction to injury and healing. Because all injury, all healing occurs through bleeding, inflammation, scar formation, and scar remodeling. The inflammatory phase occurs during post-op day 3 through post-op day 10. And it turns out with minimally invasive surgery, people have more pain on post-op day 3 than they do on post-op day 1. Similar to a situation where if I went hiking up Cowles Mountain today, in 2 or 3 days, my thigh muscles would be so achy and sore because I overexerted myself, because I'm not much of a hiker. And the inflammatory process of healing will kick in, and around 2 or 3 days post-event, I'll start to get achy and sore, and it'll last like a week. I suspect almost every one of you is familiar with that phenomenon. And guess what's going to happen after your back surgery? Same thing. So The inflammatory process makes a big difference, and one of the best predictors of how robust your inflammatory process is how you responded to a similar surgery previously. So if you had like a shoulder surgery or knee surgery or hip surgery, and afterwards you were just completely inflamed and took a little bit longer than expected to recover, guess what? It's very likely that you'll have a similar kind of reaction after my surgery. If on the other hand you had a hip replacement or knee replacement or shoulder surgery or something, and you just got through it with flying colors and all your doctors are surprised at how well you're doing, guess what? The same thing will probably happen. That's the kind of thing that you can't do anything about, and we'll just have to wait and see, and you'll be surprised at how variable it is, because I've done some surgeries that are big and think the patient's gonna be miserable for a month or two, and they just walk right in and they just say, I don't have that much pain, I'm just stiff. Not possible, but that's where their reaction is. And I've had patients where I do a tiny little surgery and they're like out of their minds in pain, and it's not anything that they can help, it's the inflammatory process, and I tell you that so that you just brace yourself, and we'll keep our fingers crossed that you're in the latter category of the low inflammatory responders. I like to call them that. I need a better name, but that's essentially what it is. The other thing that has a great effect on your recovery is your underlying state of physical fitness and health. What I mean by that is, I'll give you an example. If you're in so much pain and you're so weak and debilitated that you can't go up the stairs, it's very likely that it'll be a while before you can go up the stairs. But if before surgery you have no problem going upstairs, guess what? It'll be very likely that after surgery you'll have no problems going up the stairs. I'll have some post-op pain, so it won't be the same, but that's the example of the importance of not letting yourself get so weak and debilitated immediately before surgery that after surgery you're starting so deep in the hole that it's just too difficult to recover from. So I always advise my patients to continue to exercise, not too much, not too little, kind of like watering a plant. You can overwater a plant, right? You can also over-exercise, but you can also underwater a plant. And most of my patients under-exercise, so I always am trying to get people to find that perfect amount of exercise that allows you to stay fit, but not so much that you cause an aggravation or a flare-up, and not so little that over time you're just getting weaker and weaker and weaker. So my guess is that there's not much you can do about it if you can't exercise due to your pain, but if you can exercise, don't think that resting before surgery is the best thing. You want to kind of get back to a normal daily routine. So trying to get back to your specific question, what's my recovery going to be like? That's my long-winded way of saying it depends, because everybody's inherent inflammatory response to injury varies, and people vary in their level of health and fitness. And even having lots of medical problems contributes to that. So we should talk about that in more detail, because my philosophy is about customized precision medicine. So all those 6 weeks of no bending, lifting, or twisting, and 3 months of no sports, those are all numbers that came about over time, averaging everybody into one big blob of a person without any identity. And I noticed that if I try to do that, I confuse patients, and some patients recover their recovery is way longer than it needs to be because I've held them back too much, and other patients feel like they're not keeping up because they're not abiding by my 6, 12, 4-week, 1-week schedule, and they can't help that. So I would prefer that we go about letting you find that sweet spot of not too much, not too little. And probably the simplest thing you can do is just let pain be your guide, and as long as you're not a goofball, and as long as you're not so narcotized that you don't know what's going on, if you're awake and conscious and can monitor your levels of pain, it's best to kind of ramp up until you feel like, ugh, that's too uncomfortable. And think of it another way. It's not perfect, but it's pretty common that people can tell the difference between good pain and bad pain. For example, if I were to stretch my fingers out like this and stretch out my muscles, or stretch out my hamstrings, when I do that, it may hurt a little bit, but it's kind of like, oh, wow, that hurts so good. If somebody came and just bent my wrist forcefully, I'd be like, whoa, that's bad pain. It's not perfect, but even that is an important component of optimizing your recovery. And so the take-home message is the recovery will be variable depending on your particular situation. And when you come to the pre-op clinic, that'll be one of the specific nuances that we'll talk about, because that discussion has to be customized to you. So after surgery, you're gonna have some surgery pain. You just can't help it. The sun rises in the east and sets in the west. You render somebody unconscious, you strip them naked, and you assault them with a sharp instrument. It's gonna hurt a little bit. And we do all the things that we can intraoperatively to minimize that postoperative pain, i.e. be gentle, use delicate Asian fingers to do the surgery, use specialized equipment to do the surgery through small incisions. And then afterwards, yes, we believe in pain medicines for that problem. Now, here's the thing about the pain medicines. It's a fine balance between controlling your pain and letting your body know that it had an injury, it had surgery, because the brain knows and it expects a pain signal to come up, and it's not good to give you so much pain medicine that you think, wow, I had surgery and I don't even know because I have zero pain. It doesn't work like that. We have to find that kind of amount of pain that is reasonable so that your brain starts to kind of deal with it, but not so much that it slows down your recovery. So what does that look like? It looks like this. Are you having much pain? Yes, I'm having pain. Is it so much that it's affecting your recovery and your function? No, but Dr. Kim, you're a very mean person. I want to be pain-free starting immediately after surgery. I do that not because I'm a masochist or a sadist. I do that because in the long run, your recovery will be much more rapid, and more importantly, at 3 and 6 months, you'll just be that much better. Because some people just never catch up, and we're constantly trying to fight that. So the pain medicines will be sort of like this. I don't want you to be at an 8, 9, 10, 11, obviously, and I don't want you to be at 1, 2, or 3. I want you to be around a 4 to a 6. Because I noticed that's about the amount of pain that allows you to kind of protect yourself. Remember, let pain be your guide. And let your brain know that something happened, and it starts doing all these crazy brain things to accommodate and heal. But not so much that you just are suffering. Suffering is not a good thing. Having pain and suffering slightly into two different things. Suffering is you're having so much pain, it's just terrible. Versus I'm in pain, oh well, next topic. So no suffering, just get it to that pain so that you can monitor your recovery and use that to ramp up as fast as possible. So I will make sure that you don't suffer, but forgive me now for when I say this is the normal amount of pain and we have to just bear with it. Because if you can stand it for 2 weeks, it gets better dramatically after that. If we try to control your pain down to like a 2 or a 3 with tons of narcotics, that won't happen for 6 months sometimes. So that's my apology in advance for seeming like I'm a little strict with the pain medicines, but it's really for your own long-term benefit. And I'll work with you on that because after surgery, we're gonna be family. One of the components of this customized precision medicine has to do with one of my little pet peeves. You're gonna hear probably from somebody, probably like somebody in line at the grocery store that you're going to be in, that after spine surgery, you should adhere to the BLTs. No bending, lifting, or twisting. I do not believe in BLTs. I want you to bend and lift and twist and turn as soon as you feel comfortable to the degree that you can do it and you go, that's about where I can go. And after that, it's like really bad pain. So I don't think that's good. Because just imagine I, or your family member, decided we're not gonna bend, lift, or twist, or turn our backs with you in solidarity. What do you think our backs will feel like in 6 weeks? Not so good. So, the no BLTs mantra came about from like 50 years ago when we used to do surgery without internal instrumentation, screws and rods and cages and things like that, and instead put people in body casts and laid them in bed. Because without that, the spine would just keep moving and nothing would heal properly. That was like 50 years ago. We now use sophisticated instrumentation. We use intraoperative imaging, including image guidance and navigation, and it is rock stable. And when you have that, it's better to gently bend and lift and twist and turn, because it turns out the human tissue responds better when it knows what's expected of it. So if the back muscles need to be fired and turned and twisted, it's better to slowly do that during the healing process, so that during scar remodeling, it remodels to the best tissue and not old person, I'm stiff and I haven't moved in 6 weeks tissue, because once that happens, undoing that scar like that takes months. And what I noticed is that my patients that are a little crazy, the ones that drive me berserk with all the little calls during the first month, at 3 and 6 months, they are an interstellar distance better than my nervous Nelly patients that show up, and even after I've told them multiple times, I want you to gently bend and twist and turn and let pain be your guide and ramp up, they somehow get it in their mind that they should not do anything for 6 weeks, and they show up with, Dr. Kim, when can I start bending, lifting, and twisting? And I go, you can start now, but I already know that their recovery is going to be months out. Whereas my patients that are kind of pushing the envelope just a little bit and getting a little flare up here and there and calling me on a Sunday night telling me my back hurts, I'm really worried, and it's because they went bungee cord jumping. At 3 and 6 months, I can hardly even get them to come to the office. They're just out there. So I don't want you to overdo it, but I want you to keep in mind that we're about customized precision medicine, and your recovery is going to be tailored to you, and we're going to try to get you to recover as fast as possible, but not too fast for you. So I apologize in advance for how long the pre-op clinic appointment is going to be, but there's just a lot of paperwork. It's America 2019. Love paperwork, so brace yourself. We'll try to make the process as easy as possible. And we're all excited about your upcoming surgery. We're all hoping that you're going to get a great result and that you'll be back to your old self again. And we're all excited to meet the new and improved you after surgery. So best wishes, and I'll see you on surgery day.